First, I'm going to be assessing cranial nerve 2, the optic nerve, by having the patient cover one eye at a time and reading from the chart here.
E, D, F, C, E, P.
Okay, other eye.
E, D, F, C, E, P.
Okay, and whatever level of vision acuity, it would be like 20/20 and just assess like that. Okay, next I'm going to be doing visual field, assessing visual field by confrontation, by sitting level with the patient, covering one eye at a time, looking directly at me, and all 4 quadrants. Let me know when you see my finger.
Now. 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 Now.
Okay, other eye.
Now. 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 Now.
Okay. Next, I'm going to be assessing cranial nerve 2, the optic nerve, and cranial nerve 3, the ocular motor nerve, and looking at pupil size and pupillary response, looking that the pupils are 3 centimeters in round, which is normal finding. Next, for the light response, I'm going to shine into the right eye and see the pupil constrict, then dilate, left eye, constrict, then dilate, and then consensual light response, when I shine into the right eye, the left pupil will also constrict. So right eye constricts, left also constricts, dilates, left constricts, the right also constricts, and then they both dilate. Next, I'm going to be assessing the near response and the convergence test. So when I move the pen light near, the pupils constrict, look up, they dilate, look back down, they constrict, and then convergence. When I move the pen light in closer, the eyes naturally converge in unison, normal finding there. Next, I'm going to be assessing cranial nerve 3, ocular motor, cranial nerve 4, trochlear, and cranial nerve 6, the abducen, and they're responsible for eye movements. So I'm going to do assess for extraocular eye movements in the 6 cardinal directions. So keep your head straight and just follow my finger with your eyes in the 6 cardinal directions. Here I see an absence of stigmatism, and when I'm looking at the eyelids, absence of ptosis. Next, I'm going to be assessing cranial nerve 5, which is the trigeminal, and I'm going to be palpating the temporal and masseter muscles while the patient clenches their teeth together, equal contraction bilaterally, and then open your jaw and move side to side, symmetrical there. And then next, I'm going to be assessing light and sharp touch in the 3 divisions with the patient's eye closed. Tell me if it's light or sharp.
Light. Light. Sharp. 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 Light.
Okay, patient was able to feel correctly, normal finding. And then cranial nerve 7 is the facial nerve. So raise your eyebrows, close your eyes really tight. It's all symmetrical, frown, symmetrical, smile, show both teeth, and then do like a full smile showing your teeth. Okay, perfect. And then puff out your cheeks. Perfect, all symmetrical. Next, I'm going to be assessing the vestibular cochlear nerve, which is cranial nerve 8. So cranial nerve 8, vestibular cochlear nerve. So it's a whisper test. So you're going to occlude one ear. I'm going to whisper 3 things, and you let me know what you hear. Candle, driveway, street.
Candle, driveway, street.
Perfect. Paper, library, study.
Paper, library, study.
Perfect. And then we have cranial nerve 9, which is the glossopharyngeal, and then cranial nerve 10, which is the vagus. So I'm going to have the patient say ah and open their mouth, and I'm going to see that the soft palate rises symmetrically, the uvula is midline, and then both sides of the posterior pharynx moved in medially like a curtain. So all normal there. And then say, today is Friday.
Today is Friday.
No hoarseness in his voice, no nasal quality. Next is cranial nerve 11, which is spinal accessory. And I'm going to be assessing the trapezius muscles. They are both symmetrical, no signs of fasciculation, no signs of atrophy. And then push up against my hands, equal muscle strength on both sides. And then turn your head one way and resist my hand. The sternocleidoid mastoid here, assessing that opposite one, and then turning your head that way, resist, assessing this opposite sternocleidoid muscle, and they're both muscle strength is equal on both sides. And then Next, I'm going to have the cranial nerve 12 is hypoglossal. So open your mouth, I'm going to look at your tongue, no signs of atrophy or vascularization, and then stick out your tongue all the way, no deviation from midline, normal finding, and then move your tongue side to side, symmetrical, normal finding.